we're now open for questions.
I just get back to the recipient, and just wondering how he's physically doing. Can you give us a little bit more of how he is and what he's experiencing and what his long-term prognosis is?
Sure. So he's doing well so far. We spoke with him this morning. He's up and about, out of bed, and progressing cautiously and conservatively in his course, but we think he's on a path to recovery. He's emotionally doing amazing. I'm really impressed with how well he's handling things, and he's just a very positive person. And his outlook is that he wants to share this technology with others who need it, and he is one of those people who's open to. He actually does speak with other people who've gone through penile cancer and try to be supportive in that way. And he feels that he would be able to do this even more so to a greater extent now after going through a recovery. He was telling me this morning, he said, if you just give a little bit of hope, it goes a long way to getting through such a devastating thing that he's gone through.
Just to follow up on that, so there's no sort of, at this point, concerns about his psychological well-being at this point in terms of being out there for?
No, I mean, we went through a pretty rigorous psychological screening and made sure his motivations for this transplant were appropriate, and in our view, they couldn't be more appropriate. He wants to be whole again. He wants to not be, as Dr. Koh said, in the shadows and about an injury such as this, and that's really echoes what many patients with these kind of injuries feel like. It's something they can't even talk about. They have difficulty even relating with their male friends or whomever, and it just stays quiet and makes them isolated and oftentimes very despondent. So his motivations were perfect as far as we could find for this kind of procedure.
And that really speaks to the fact that when I mentioned that many of these patients suffer in silence, and for years he's been like that, and I think now he's found a voice to come out to say how much he has really found hope in this type of procedure. So I think our psychological evaluation of this patient has been very good and very strong, and we know that he should find a good way for recovery.
Yeah, I mean, at the same time, we're cautiously optimistic. It's still early days. It's still early in his course, and we've learned a lot already. But we're hopeful that, with this kind of experimental surgery, that we can learn enough to make it safe and routine. It doesn't mean it's all going to go perfectly all the time, but so far we're doing okay.
How far out do you see where it could be routine?
It depends. It depends on a lot of factors, on how we fund these operations through research, and how we can manage immunosuppression. We have a research effort that tries to get rid of immunosuppression. That would be a big leap in the right direction to open this up to more patients in the future.
I understand there's been a couple of these internationally, only one of which I believe was successful. I was wondering, first of all, you confirm that, and also your concerns going forward, the risk of rejection. What are you looking at going forward to make sure that this is a success?
There's been two cases reported in the literature, one in South Africa and one in China. Both were initially successful. The Chinese patient, as far as we know, had difficulties with the immunosuppression required to prevent allorejection, and so eventually the allograft was removed. The South African patient continues to do well by all reports. But as far as our concerns about rejection, it's, again, uncharted waters. We've taken care of many patients, and over the world history and world literature that have gone through this, we term it vascularized composite allotransplantation. They require the same immunosuppression that, for example, a kidney patient would require to prevent rejecting the allograft. So at least with our experience in our hand transplant patient, we followed the same protocol, and we're hopeful that our patient will do as well as the hand transplant patient has done as far as rejection, which he has not had rejection episodes. So we're hopeful that our protocol will be as effective in this case. But again, there are different tissues involved, different lymphatic tissues, so we'll just have to take it day by day and see how we go.
Did you have any contact with the teams in South Africa or China, and if so, how did you improve on their techniques?
So The South African case was presented live at the International Composite Tissue meeting last spring, where, and we did have a more detailed view of their procedure and their publication as well. So, but in one case, every case is somewhat different from the recipient anatomy and the donor procurement. So we really had to tailor our procedure to our patient and practice with the resources we had and the team that we had to make it work for us. So and that took a lot of work from a lot of people in the audience. So it was really a team effort, and I'm fortunate to have amazing surgical colleagues who can pull something like this off, because it was a real team effort. He is not married, no.
And the second question is, does this, may think it's left field, does this have any ramifications at all down the road? You're talking about wounded warriors, so forth. Is there any ramifications at all possible for transgender people who want to do this?
Sure, that's sort of, I mean, it's outside the scope of what we're trying to get to it, but I don't see any, any contraindication to that being an option in the future. It's something we're thinking about in an academic sense, but again, the scope of our effort at present is first our own patients that we can help, and then hopefully opening the door to other traumatic injuries. And if all goes well, that would certainly be something for us or other groups to entertain if possible. Technically, I think it's a possibility. Whether it's immunologically, that'd be another question to ask, but sure.
Can you speak to any of the unique challenges with particular surgery are, and why sort of it took so long to get to this point? Why did this surgery? I mean, there's been transplants for a while. Was it particularly hard to do this kind of surgery, and are there challenges that you had to overcome in order to make it happen?
Again, I think it's on a continuum of other transplants: hand, face, abdominal wall, all soft tissue transplants, which fall under the same umbrella that we're moving forward. So as we gain experience with those other allografts, like a hand, I mean, we felt confident to be able to do this operation because of our experience with hand and how we managed them psychologically, medically, from an immunosuppression standpoint. So I kind of took that experience to get here. And as we go forward, I think we'll be entertaining other complex anatomic units, like hopefully someday I envision a nose, lips, an ear, a digit, something that, things that are really hard to reconstruct with our typical means at this time. We see that as this is just another extension of that. So it's a march on the right path, and I don't think it took any longer than some of our other protocols. It just takes a lot of work to make sure we're doing it correctly, especially when it hasn't been done before. So,
On the urologic front, more or less, it's an extension of the experience that's learned from all the traumas in all reconstructive surgery. What to hook up, where is the best vascular supply, and how to prevent strictures or narrowing or complications from occurring in the future. So it's a real combination of a lot of expertise that our entire team have gained in our day-to-day work to put it all together to do this composite graft.
Just to follow up on the previous question about transgender surgery possibly, how much of a leap would it be to get to that sort of surgery based off of what you guys did here?
I mean, it depends. It depends on some of those procedures would need to be worked out, but with people with a lot of experience in the anatomy. So I think while it's on the same continuum, we're not quite there yet as far as the planning goes. I think it would take another whole refocused effort to make sure it's safe and anatomically and surgically possible to do a good job at it.
Yeah, along the same lines, our team have had a lot of discussion about that in view of all the news stories and what's been current in the last 18 months. We put a focus on cancer and trauma as our first phase, simply because we have to put a proof of concept in terms of a reconstruction, having putting together the parts that are available. And the considerations into the future will take a refocus into what is possible anatomically and what are the parts that need to be replaced. That will come further discussion into the future, but as of now, We have a lot to learn from this procedure, and we have a lot to gain from the further experiences over time before we can make that type of leap forward.